I'll use the words of one of our nurse practitioners. My first week on the job, I asked her, what do you love about this place and what makes this place so special? And she said, we're big enough to serve you, yet small enough to know you. And I think that encompasses what makes Horizon Health unique.
This next year will be 29 years in medicine for me. So over that journey, I've been at level 1 trauma centers, level 2 trauma centers, big institutions, smaller institutions. Some friends of mine that worked at Horizon Health said, you have got to come and see Horizon Health for yourself. Wish they would have said is, you need to come and feel Horizon Health for yourself. When I came over here and toured the facility, I was really just in awe, just dumbfounded by a critical access hospital with this large of a footprint. But the culture that exists here is what brought me here.
The thing I noticed the most, which was very unique, is that everybody smiled. When you see that, you know that people are proud to work here. They like to celebrate their wins. They care. People underappreciate the work environment.
Oftentimes in these larger areas, these larger systems, the patient becomes just another number. The employees become just another head. And they lose track of why they went into healthcare in the first place. And the team here, the organization here, is a laser focus on taking care of the patient and taking care of each other.
This facility is very patient-centered and focused and very organized. It's a joy to work in that kind of environment.
I think one misconception about Horizon Health is because we are in a smaller town that we don't offer the same, top level of care that other larger facilities have to offer, and that's just not true.
Horizon Health has the cutting edge technology as far as radiographic type of technologies, but also high level surgeries. We're doing front back spine cases, total joint replacements, laparoscopic bariatric procedures. That is a rarity in critical access hospitals.
We're proving to patients that you don't have to go to a big city, you don't have to go to a large facility where they don't maybe know your name. You can stay here and we can provide the same level of care in a close-knit organization 5 minutes from your house.
You get to practice a wide scope and a wide breadth of your services and expertise, and you really get an opportunity to connect with your patients.
There's a lot of gratification working here, from the variety of cases that we end up doing, the complex cases that we do.
There's enough acuity for you not to lose your skills, but it's not so crazy busy that you don't have time to talk to people. I feel like I have enough time to do that. I can go in and explain things and educate people.
I often hear patients talk about how everyone here is so kind, so nice, always smiling. And again, it's that personal touch that really sets us apart from other larger facilities.
My patients know my staff, they know my nurses, they know my unit secretary, they know me, they know my surgeons. I don't think you have that in a larger facility.
The Midwestern patient population is usually a very compliant and a very appreciative population as well. So it's very rewarding as a healthcare delivery person to be able to sit and talk with those folks and just have a relaxed atmosphere.
I think a lot of people underappreciated the quality of life the Midwest can give you. I get to spend more time with my family than I ever hoped for. So there's nothing more to that.
Your dollar stretches a little bit further in a rural community. So when you think about long-term financial benefit for you and your family, I think a rural community makes absolute sense.
I feel like you get a more personalized connection with administration. It's not uncommon to see administration coming through the clinic and checking on us, seeing how things are going. And you feel like as a provider and as a physician that your opinion matters.
Every day that administration door stands wide open for providers to come up and voice their opinions, ask their questions.
Putting the physicians and the nurses at the table to make decisions for what the clinical workflows look like. And I think that's a big change from what you may experience in some other organizations.
Everybody's committed for patient excellence, quality outcomes, patient safety. The competencies here are extremely high. Everyone is very well trained and everyone's committed together.
It's really a community, and the hospital, the staff is part of the community and the community knows that. So it's really like treating family.
What you do have here is a team of folks, from nursing staff to environmental services staff to food services staff to administration, and your colleagues and APPs and providers that are willing to step in and help you figure out how to take care of that patient.